My name is Dr. Sandeep Morkhandikar. I am a nephrologist practicing in Pune. My clinic is in Kalyan Nagar and I usually practice in Ruby Hall Clinic, Pune. So I am here to discuss few important aspects of the kidney and kidney disorders today. I'll target mainly three today. First being the functions of the kidney, second being the symptoms, and third is the dialysis. So in the functions of the kidney does have a lot of functions to do. The most common being is the excretion of the waste product. Body produces a lot of waste products because of food intake or other metabolism. That a majority of them are excreted from the kidney. In most common term, we can say the urea, creatinine, uric acid are the few examples of these waste products. Second, control of blood pressure. For every human being, the blood pressure is controlled by the kidneys, and the reason being, kidney has the receptors or the functional chemical functional milieu for control of blood pressure in the kidney, and secondary effects of that uncontrolled blood pressure are usually manifested in the different organs, which mainly being the heart, brain and other organs depending upon the everybody's presentation. Third function is control of the body composition or electrolytes. Kidney controls almost all electrolytes in the body in the form of like sodium, potassium, calcium, phosphorus. Multiple other things are controlled by the kidney. Another very important function of the kidney is controlling of body acid-base balance. This is very important function of a body. To be healthy in body, we should be in the health. The health is usually maintained by these quality functions of the kidney. Kidney and the lungs, these are two organs which maintains this acid-base balance in the body, and this is very important part to be in the appropriate acid-base balance. Another very important function is production of vitamin D, active vitamin D. Majority of the people think that the skin is the site of vitamin D, but no, skin is a primary inactive form of vitamin D that is getting activated in the kidney. The enzymes for that activations are present in the kidney, not in the skin. Another very important function of the kidney is control of hemoglobin in the body. For every human being, the hemoglobin production or control is produced, the hormone is produced by the kidney. That is called as erythropoietin, which acts in the bone marrow and produces the appropriate required dose or level of hemoglobin particular to every individual. These are very important functions because these are sometimes we can say unknown functions of the kidney for a routine or our general population. So these are the overview of our functioning of a kidney or what does kidney does. Now comes to the symptoms of the kidney. What does kidney symptoms are there? Before that, most important want to say what can cause kidney damage also. Most common cause is blood pressure and diabetes. These two are very common cause of kidney failure. 40 to 60% populations are affected who have a kidney disease. They are affected by these two problems like blood pressure and diabetes. Usually, majority of the time, uncontrolled blood pressures, unmonitored blood pressures, uncontrolled blood sugars are the etiology of these kidney problems. Definitely, there are other causes of kidney failure in the form of repeated kidney infections, kidney stones, untreated kidney stones, genetic problems like cyst in the kidney or water bubbles in the kidney. There can be a lot of obstructive block in the kidney tubes and other autoimmune disorders like lupus, if anybody is aware of that kind of thing. So these are the different disorders that can cause kidney problems, and there are symptoms. So one of the most common symptom of kidney problem is a feeling tiredness or feeling short of a breath. As we know, kidney, as I told in the past discussion, kidney produces the hormone to control hemoglobin. Once it is going down at a particular level, overall activity goes down. It may not be a sudden, sometimes it may be a subtle manifestations, very small, but definitely one of the earliest manifestation. Definitely, another symptom is ability to think properly or in a finite, like fine calculations. Because as I told you, acid-base balance is very important for a fine functioning of a brain. And once these are affected because of the kidney function, automatically you will get signs and symptoms of these disorders. Not feeling well or not feeling eating, there is another sign because of the retention of these waste products in the body. Having very dry skin, muscle cramps, these are another few signs and symptoms of kidney problems. Definitely, as we know, kidney processes the urine. So often a problem in going urine, too less or too much, both are associated with the kidney problems. Another symptoms like swelling in the legs, puffiness of face, swelling in the abdomen. These are the overall signs and symptoms of water retention in the body, and there is usually linked to the kidney problems directly or indirectly. So once the kidney, as you know, there are symptoms, so there is always a level of kidney damage. One of the most common question asked, are my both kidneys damaged? Usually there are few rare disorders. Most of the time both the kidneys are affected equally in majority of the disorders, which include diabetes, hypertension, or cyst in the kidney. There are different stages of kidney failure, like stage 1, stage 2, stage 3, stage 4, and stage 5. Usually stage 5, what we call as a kidney failure in a layman or a local language, and these are the people who require kind of a dialysis if they are unwarranted, they don't get a treatment in a proper way. What is a job of a nephrologist? As a routine, job of a nephrologist is not to take any patient to stage 5. How to bring patients from stage 5 to stage 1 so that they have a better kidney function or normal kidney function. So if you are able to do the proper test, proper investigation with the proper approach, what is needed for the treatment of your kidney problem, there is a good amount of chance that we can control the disease at an earlier stage than the later. Once you are in a stage 5, the response to the treatment goes down very badly, and the response to the medications as well as the cost of the medications really goes high. Definitely, as we know, as we are speaking about a stage 5 or kidney failure, as we have always heard of dialysis. Most commonly asked question is dialysis is permanent. There are lot of reasons for dialysis. People with the malaria, dengue, leptospira also require dialysis because of some problem, because of these or disorders can damage the kidney directly or indirectly. Once the disorder recover, patients come out of the dialysis. Lot of painkiller medications can now cause kidney damage. Once the effect is gone, they also recover from the kidney. But this cannot be a perfect rule or 100% rule in the body. So there are always some disorders, like as we discussed, like cyst in the kidney, diabetes. Sometimes these can permanent damage to the kidney and they are usually unrecoverable. So there are few do's and don'ts, particularly for dialysis population, like checking blood pressure, checking sugars, checking weight every day, avoiding tight clothes if you have a fistula in the arms which can compromise your this thing, and not to take any over-the-counter painkillers, not to take unnecessary medications. Usually you should always proper follow-up and proper test is required to get a proper dialysis and avoid the side effect of improper dialysis. Definitely there are few don'ts, that you should not get a blood sample from a fistula, AV fistula line, avoid blood pressure checking at the fistula arms. Usually you should avoid the painkiller medications, and you will try to avoid scratching over the fistula arm. Don't let the fistula arm get dirty or damaged during or compressed during the traveling and other things. So let's finish it here today along with the dialysis care, and next time we'll come with the transplant donations, who can donate, what are different types of transplant, medications for a transplant, and other aspect of the kidney problems. Thank you everyone, have a good day.